So muscle dysmorphia is a subtype of body dysmorphic disorder in which the area of preoccupation is one's level of muscularity or body size. Typically affects males, although women can also have muscle dysmorphia. So these are individuals who actually could be quite muscular, quite fit, and see themselves as looking too small or too weak. So treatment would actually look at targeting the obsessive thinking around the body. So these are individuals who are always thinking that they look too small. And then that's coupled with a lot of behaviors, either compulsions like mirror checking, compulsive weightlifting, comparisons to other people, or certain avoidant behaviors. Like these are individuals that won't wear short sleeve shirts in the summertime, won't take their shirts off at the beach, may not even be seen in certain places because they fear that people will perceive them as too weak. So treatment would be similar to what you would see with BDD that really targets those avoidant behaviors and compulsive behaviors. So with a typical muscle dysmorphic patient, I might first start at looking at their compulsive exercise or weightlifting. So again, these are patients who might work out 4 to 5 hours a day, and we try to get them down to a normal, sort of healthy amount, because there's nothing wrong with working out as long as you're doing it in a healthy fashion. We would expose them to social situations that they typically would either avoid because of the fear of being seen, or they might not go to because they're at the gym spending too much time on their compulsive behaviors, that they might miss very important social events. Part of the treatment, seeing that about 50% of my patients with muscle dysmorphia engage in the use of anabolic steroid use. We really look at ceasing anabolic steroid use, which is very difficult. A lot of these patients find it very difficult to not use steroids anymore because it's a guarantee that their body is going to decrease in muscularity. So we would really work at all of those things and then also address what the underlying theme is. What is it that draws them to be so preoccupied in terms of what their level of muscularity means to them, and what are the themes around having a bigger muscular body. So themes that we would typically see, these are typically patients that struggle with low self-esteem, struggle with social anxiety, some have a history of trauma, all of which really make having a bigger, more powerful body very salient to them. So a lot of these men, again, I treat mainly men with muscle dysmorphia, a lot of these men would say, I need to look big to compensate for how small I feel on the inside. I don't want anyone to think that I'm weak. I don't want someone to mess with me. People who maybe have a history of trauma or a history of being bullied feel that building a bigger body really conveys a sense of power, a sense of threat to other people. So the meaning behind the muscle is something that we have to address as well. And then that means we're also working with trying assertiveness skills and trying to decrease the social anxiety, trying to build confidence, all of which really help these individuals in not relying so much on their external physicality to compensate for what they feel they lack on the inside. So common misconceptions about muscle dysmorphia include that these are not the guys that you would see at Venice Beach, for example, parading their bodies. These are not individuals who are vain, are narcissistic. These are the guys that might be going to the gym, the 24-hour gym at 2 in the morning, so they're not seen. They might be covering up their muscles on a 90-degree day because, again, they fear that people are going to perceive them as looking too small. So a big misconception, especially if you do see these guys at the gym, is that they're very self-centered, very into themselves. They think so highly of themselves, and that's couldn't be farther from the truth. These are men who really feel very little about themselves to the degree that they feel they need to be working out multiple hours in a day, engage in very idiosyncratic eating behaviors. About a third of men with muscle dysmorphia have an eating disorder as well, which is something that also complicates the treatment and something that we have to treat. Another common area is that a lot of these men get rewarded for having a big body, in the sense that people would say, wow, you're so disciplined, you're so strong. And so they hear that and think, oh my gosh, I really can't lose any muscle mass. I can't gain any body fat. So there's a lot of pressure, unlike someone with anorexia, who maybe initially, if somebody's losing weight, might get a similar social reward, but then after a while, when someone's emaciated looking, they're not getting that same positive feedback. These are men that even if people think they look freakishly big, it still confirms that they are big and that they are intimidating in some ways. And that still is appealing on some level, especially if they're compensating for feeling very weak on the inside. Many of these men also struggle with just in terms of feeling masculine, and a lot of times they might have other BDD concerns around their hand size, their penis size, their height, all of which sort of, again, convey this sense of, am I looking like a man? And muscularity is clearly a very distinct biological marker for men. So it's something that is very appealing for these men to adhere to. So muscle dysmorphia primarily affects men, although there are cases of women with muscle dysmorphia. There's less known about them simply because we haven't studied them as much. The little that has been studied with the smaller sample sizes of women find that women with muscle dysmorphia tend to have a history of trauma, a history of rape or sexual assault in their background, of which building a very strong muscular body is almost used as a defense in a lot of ways. But again, all 99% of the patients, I've only worked with one woman with muscle dysmorphia, and the other 99% basically have been men. And that's mainly because socially, the ideal for a male body is one that's highly muscular, very strong looking, and societal ideals for the female body doesn't rest upon looking big and muscular.